Tuberculosis, TB, a disease as ancient as civilization itself, has left a deep imprint on human history, persisting into modern times despite advances in medical science. It is caused by the bacterium Mycobacterium tuberculosis and primarily affects the lungs, though it can damage other parts of the body as well. The traces of tuberculosis are found in the remains of ancient Egyptians and prehistoric humans, suggesting its presence thousands of years ago. The disease proliferated with the advent of agriculture and urbanization, which brought people closer together and facilitated the airborne transmission of the bacteria. Historical periods saw TB becoming a scourge in densely populated cities, where it thrived among the poor and malnourished populations, taking on epidemic proportions in times of distress or societal upheaval. Transmission of tuberculosis is primarily airborne, occurring when people with active pulmonary TB expel bacteria into the air, such as through coughing. When inhaled by a healthy individual, the bacteria can settle in the lungs and multiply, leading to infection. However, not everyone infected with the TB bacterium becomes sick, which leads to the distinctions between latent TB infection and active TB disease. Those with latent infection do not show symptoms and are not contagious, but they still risk developing active TB if their immune system weakens. The persistence and prevalence of tuberculosis are influenced by several factors. Poor living conditions, inadequate health care, and poverty enable its spread, especially in developing countries. The HIV/AIDS epidemic exacerbates the situation, as HIV weakens the immune system, making individuals more susceptible to activating latent TB infections or acquiring new infections. Furthermore, the emergence of drug-resistant forms of tuberculosis, such as multi-drug-resistant TB, MDR-TB, and extensively drug-resistant TB, XDR-TB, complicates treatment efforts and control measures. Efforts to combat tuberculosis are extensive and include global health initiatives aimed at improving diagnostics, expanding access to treatment, and integrating TB prevention with HIV/AIDS healthcare programs. However, TB remains one of the top 10 causes of death worldwide, underscoring the need for enhanced healthcare infrastructure, socioeconomic improvements, and continued research into new treatment options. Tuberculosis, TB, is one of humanity's oldest adversaries, with its traces dating back to ancient Egyptian mummies around 2400 BC. The disease, caused by the bacterium Mycobacterium tuberculosis, has been a major cause of death and suffering throughout history, particularly notorious during the 17th to 19th centuries in Europe, where it was dubbed the White Plague, due to the pallor of its victims. The impact of TB intensified with the rise of urbanization, as crowded living conditions and poor sanitation provided a ripe environment for the spread of this airborne disease. By the 19th century, tuberculosis was responsible for nearly 1 in 7 deaths in Europe, making it a leading cause of mortality. The disease continued to wreak havoc into the early 20th century, underscoring a dire need for effective control and prevention measures. The battle against tuberculosis saw significant advancements with the introduction of the BCG vaccine in 1921, which, despite its limitations in preventing adult pulmonary TB, considerably reduced the risk of severe forms of tuberculosis in children. The development of antibiotics in the 1940s further revolutionized TB control, with drugs like streptomycin making it possible to effectively treat and cure infectious patients. Public health interventions have played a crucial role in combating TB. Improvements in nutrition, housing, and overall sanitation, coupled with rigorous public health campaigns, helped curtail the spread of the disease. TB sanatoriums, which isolated patients during infectious periods, also contributed significantly to reducing transmission rates. Today, treatment typically involves a lengthy course of multiple antibiotics, a strategy that requires careful management to avoid the development of drug-resistant strains. Directly observed therapy, DUT, ensures that patients complete their treatment regimen, which is critical to prevent relapse and further resistance development. Modern TB control heavily relies on surveillance systems that track disease incidence and monitor treatment outcomes. These systems are crucial for detecting outbreaks and adjusting public health strategies timely and effectively. They also play a key role in managing the spread of multi-drug resistant TB, MDR-TB, and extensively drug-resistant TB, XDR-TB, which pose significant challenges due to their resistance to standard treatments. Tuberculosis, TB, once the leading cause of death in industrialized nations, has seen significant declines in incidence thanks to advances in medical science and public health interventions. However, TB remains a major global health issue, particularly in low- and middle-income countries where healthcare systems are less developed. Historically, TB was a devastating disease with widespread fatalities. By the 19th century, it caused about 1 in 7 deaths in Europe. The development of the Bacillus calmette-guerin (BCG) vaccine in 1921 and the discovery of the first effective antibiotics in the 1940s marked turning points in the fight against TB. These medical advancements, along with improvements in living conditions and the establishment of public health infrastructures, significantly reduced TB rates in developed nations. In the present day, however, TB continues to be a pressing health issue worldwide. According to the World Health Organization, WHO, TB is one of the top 10 causes of death globally and the leading cause from a single infectious agent, ranking above HIV/AIDS. In 2019, there were an estimated 10 million new TB cases worldwide, and 1.4 million terabytes deaths. TB rates are particularly high in parts of Africa, Southeast Asia, and Eastern Europe, where HIV prevalence, socioeconomic instability, and access to healthcare exacerbate the situation. The BCG vaccine remains the only available vaccine against TB. It is most effective in preventing severe forms of TB in children but less effective against pulmonary TB, the most common form in adults. New vaccine research is ongoing, aiming to develop more effective solutions. Early detection and the appropriate treatment of TB are crucial. Treatment usually involves a course of multiple antibiotics taken for at least 6 months. Completing the treatment is essential to cure the disease and prevent the development of drug-resistant TB. DOT involves healthcare providers supervising patients to ensure they take their TB medications properly. This approach helps improve treatment outcomes and reduces the risk of drug resistance. Enhancing healthcare access and quality, particularly in resource-limited settings, is critical. This includes strengthening the detection of TB cases, contact tracing, and monitoring treatment adherence and outcomes. Integrated treatment programs for TB and HIV are vital, particularly in regions with high rates of both infections. People living with HIV are significantly more likely to develop active TB due to their compromised immune system. Improving housing, reducing overcrowding, and increasing nutrition are important in reducing TB transmission. Socioeconomic development can indirectly decrease TB rates by improving overall health resilience. The fight against tuberculosis remains a significant challenge despite historical successes in reducing its impact. Continuing to enhance public health strategies, investing in medical research for better diagnostics, treatments, and vaccines, and addressing the broader socioeconomic factors that contribute to TB prevalence are essential steps toward eradicating this ancient yet persistently deadly disease.